Hello, family. Welcome to Gem Talks. This is Marcel, aka Gem, and thank you for taking the time to check out my podcast. Gem Talks is all about taking everyday life issues and challenges and just looking at it from a more empowering and motivating way. So stick around, guys. Keep checking in, and let's keep talking about it. Hey guys, welcome back to part 2, y'all. Again, we had such a great conversation with Miss Lisa Bird, and we are excited to just go right in. So y'all, come on into part 2. So what are some of the misconceptions that people may have when it comes to addressing trauma? You know, like a lot of people say, and just to be facetious about that is like somebody went through a breakup or they've been discarded in a relationship, and they say, well, the best way to get over one is to get onto another one. I know it's a world saying, y'all. Yes, I'm bringing a little bit of the world in here. But it's just one of those things. People think that you could kind of ignore, I guess. Ignore it and it'll go away, because I tried that.
Oh yeah,
it didn't work very well.
I'm sure it didn't.
Yeah, I tried.
I'm sure it didn't.
I tried that one, but that one I can tell you for sure that one did not work.
Yes.
So what are some of the misconceptions? People things that people think is going to work, but it don't.
Oh, if I stuff it and just lock it away, I'll forget about it. I'll be able to move on. Yeah. Big lie. I can. This is another big one in the church too. Oh, well, you just need to pray about it. You just need to pray about it.
Yes.
You just need to pray it away.
That's a huge one.
That is a big misconception.
That is a huge one. And that is one that I have had problems with. Because when you're stuck, you have these thoughts ruminating in your head.
Yeah.
And you're praying about it, but you're not getting released because your soul basically is on fire.
Your soul.
You're in pain. You're hurting. You're traumatized, and people will just be very flippant about it. Oh, just pray about it.
Yeah.
And that is something that annoys me to no end.
Me too.
Because to me, that is just being so religious.
Yes.
And it's not addressing the problem.
Right.
So that is. Oh, do I feel you on that?
Yes.
That is one that really gets me, because it has bothered me sometimes when I have gone seeking help, and the person will be like, well, have you prayed about it? Yeah. Yeah. I've prayed about it. I read the word. But guess what? When your mind, depend on the state of your mind, you are not even able to receive what the scripture is saying.
Right. And if you think about that, like Jesus, when he was in the Garden of Gethsemane, right? He was praying so hard and suffering so much that he was sweating blood, and that's a human, that's like divine God who's also human, really suffering and going through. He suffered on the cross. He could have prayed, Lord, just come take me off this cross. But he suffered so that we could see that we can suffer and make it through, right?
Yeah.
I really believe that's one of the most amazing things about God being all man and all divine, is that he suffered and he cried and he showed us that we're going to go through difficult things. And it's not as simple as just praying it away. No, we're going through it.
Yes.
And he goes through it with us. So that's one of the things that I love about my relationship with God, is that I know he's there, right? I'm not going through it alone, but I also need humans to come alongside me and go through it with me.
Absolutely.
Yeah, because you can't just pray trauma away. I mean, I'm not going to limit God. I'm not going to say that he can't just instantly heal you of trauma or, painful events. He certainly can. But by and large, all the people that I serve have to go through it. We have to walk through the process of healing. And, but I've had so many clients say, oh, well, somebody told me I just need to pray about it. And that kind of hurts my heart, because they feel then like they're not praying hard enough or correctly, or they're not a good enough Christian. And none of that is accurate.
And that's bringing condemnation on themselves.
Yes. Yeah.
Because it's like, okay, well, I'm praying for this. I know I'm serious about it, but I'm not getting to my healing place. So what is wrong with me?
Yes.
That famous
Exactly.
question, right?
Yes.
What is wrong with me? And as you were
Yes.
saying that we have to go through it, I the scripture that come to mind is, yea, though I walk through the valley of the shadow of death, I will fear no evil, right? Because he is
you're
with
with
us.
me, right.
So it's like, we have to remember that God is with us. He was in the fire with Shadrach, Meshach, and Abednego, right?
Exactly.
He was in the lion's den with Daniel,
Right.
So God is with us when we are going through these things.
Yeah.
But I think we forget that our experiences that we have, good and bad, God uses it, right? He uses it in the lives of other people.
Right.
We are his hands and his feet in the earth. And so we have to show up for one another. And how we show up sometimes is being healed of our traumas, right?
Yes.
Being healed of our issues. And then now we can go and minister to somebody else because now we can identify.
Yes.
And that's another thing I think people minimize the importance of having people in your corner that can identify with your issue and identify with your trauma.
Yes.
Because I know for me, if I'm having an issue and you're coming to talk to me, but you don't have any experience with this at all, right? So you're just talking to me, right?
Right.
I have a hard time receiving what you have to say because in my mind, you don't understand my pain.
Right. And if someone says something flip like that to you, well, did you pray about it? Or, well, you just need to pray about it and you'll be better. That tells me that you don't know what I'm going through.
And that
Right?
right there, that
Yeah.
right there, because that
You're
would
not the person to come alongside me right
me.
now.
Yes. And I think also having the wrong people at your side in the time of trauma
Oh, yes.
can make the journey even
Worse.
worse.
Much worse. Yes.
And I think well-meaning people, right? They're well-meaning.
They are.
But they're ignorant
Yeah.
as to what they're doing and to the things they may be saying or trying to communicate.
Right.
They're doing it out of a place of ignorance. They love you,
Yes, they
but
do.
it's still being done out of a place of ignorance because they don't have knowledge
Right.
of that particular area.
Yeah.
Right? We don't know.
Right.
We don't know.
And particularly around, I think, grieving, people are really weird about that, right? When someone dies, a loved one dies, people just get all weird. They don't really know how to be
Yeah.
with you because being with you really is the healing mechanism, right? It's not what you say because you can't say anything. If my child has just died or my loved one has just died, there are no words that are going to fix that. But what you can do is just be there, right? I don't want to hear platitudes. I may not want to hear scripture. Okay, and that's fine too. Because in the moment, none of that is going to help. My
Yes.
soul is torn apart.
Yes.
And I know that in time, sure, I'm going to heal and maybe the word will be able to minister and speak to me. But in the moment, I might just need a hug.
That's good.
I might just need somebody to say, hey, let me get you some water.
That's good. That is real to me right now. Like I said, in the last week and a half, just watching my girlfriend go through this trauma of losing her grandbaby and watching the daughter, her only child,
Oh, yeah.
and watching that trauma firsthand, it had me in a really bad headspace, and I find myself just being angry,
Yeah.
just being totally angry, because I'm like, what reason is there, God?
Yes.
She's 5. And people come around and they don't understand that pain, and they're trying to interject themselves into that grieving person's space,
Yeah.
and they don't understand that a lot of times we're causing more trauma and pain to that individual. And I was witnessing that, and so that's real. That's real. I think. So what do you say we need to do then? So someone we know, a loved one, passed, what should our approach be in that situation? Because it's a tender situation.
It is. It is. I think my favorite question in that situation is, what do you need?
Yeah.
Because people need a number of different things at that time, right? And sometimes they can't even verbalize what they need. But so you can say, all right, in terms of making plans like for the service or something, can I assist you with that? Come alongside you with that. All right, I can do that. You need that. But you may not even be able to say that, right? Do you need to take a shower? Because in a traumatic situation like that, all of our everything just goes out the window, right? Our normal level of functioning is gone. And so we may need to be reminded, just go take a hot bath. You know what? Let me just run you a bath so you can
That's
just
good.
get in there,
That's
take
good.
care of yourself. You haven't eaten in 2 days. Like if you can't chew, you know, you're too nauseous or whatever, let me just get you a smoothie. Let me get you something, because we don't function well in the midst of crisis
No.
and trauma, right? And so we need people to come alongside us and say, hey, let me just help you with this, the practical things, right? We can't take away the pain, but we can help with the practical things.
Absolutely. Absolutely. That is so resonating with me right now, because in the midst of my friend going through this, I remember, I think the second day, my sister, who's a nurse, I called her and I said, sis, I don't know what to do. I said, I don't want to, be there and get in the way of their grieving. What am I supposed to do? Should I go? Should I stay? What should I say? She said, and my sister, who also dealt with mental health patients, she said, sis, just go and be there.
Yes.
You do nothing. You just go and be there. If they need you for anything, you are there. And I said, okay, sis, thank you for that. So I went and be there. But I was very mindful. I wanted to be there and be a source of help.
Yes.
Rather than the right word didn't pop in my head, y'all. Like I had another word that popped in my head. I didn't want to be a nuisance, right? Because I think that can happen, right? People can come in and be a nuisance because they think they know what this person needs.
Yes.
And so I'm thankful that I was able to be there in a helpful way, I believed. And you are correct. We need to ask and or just say, I'm here.
I'm here.
I'm here, whatever you need.
Yes.
I'm here.
Yeah.
And I think that we miss that sometimes.
Yes.
We think that we know and we step up to just start doing stuff that is really causing more pain and trauma.
Yes.
So are you guys listening to this? Y'all listen to this? The next time you have somebody dealing with trauma, be mindful, right? Be mindful. Just be there. Ask a question and they'll let you know. Or just be observant, like you were saying. Just be observant. You notice they didn't bathe, right? Help them in that area. Or they haven't eaten. Help them in that area, right?
Yes.
But don't say stupid words, because we have this thing for saying stupid things in the wrong time. Because I think to myself, one of the things people say, oh, is my most hated.
Tell me, it's probably mine too.
Oh, you lost someone. Oh, they're in a better place.
A better place. I knew you were going to say that.
I'm like, that may be true from our Christian perspective, that they're with Jesus. That may be true. But is that what they need to hear at the time?
No.
No.
You don't want them in a better place. You want them in this place. Right.
This place. I need them right here.
Yes.
What place is better than with me?
Yes.
So I think I've heard that so many times. And I'm like, shut up. Really, just shut up. If you don't know what to say, just shut up.
You don't have to say anything.
Exactly.
Because, and like you said, people are well-meaning. They want to help. They care about you. They want to make you feel better. I think just realizing that nothing that comes out of your mouth is going to take away that pain is critical.
Yeah.
So you don't really have to say anything
Yeah.
with the goal of trying to make them feel better.
Yeah.
Just be there, like you said.
Yeah, and I think in that moment, like you said, nothing you can say can make the situation better. It is a process that that person must walk through.
Yes.
And I think another thing, everybody's process is different,
Absolutely.
right? Everybody's process is different. What one person needs is not what the other person needs.
Right.
Right? Some people really just need to be by themselves. They don't want anybody in the air. They don't want to see anybody. And it's okay. It's okay.
It's okay for a time, because we don't want them to be
Isolate, yeah.
alone and isolating, right? Because they may really fall into a deep depression.
Gotcha.
Yes, or even become suicidal, and we don't want that. So it's really, there's no set formula for how to help someone through grief. Everyone is individualized, and so being there, asking what they need, observing, giving them space, and also giving them you. Those are the keys.
Yeah. Yeah.
And grieving takes however long it takes.
Yeah.
There's no preset time. There's no 6 months, but later you should be fine.
Oh,
A year
gosh.
later you
Oh,
should
my
be
God.
good after you go through all the 1-year anniversaries of everything.
Yeah.
All the holidays without your loved one. Okay, you're good. You should be good.
No.
No. In fact, the year after my mom died, I went through all the first time things, but actually the second year was
It was
worse.
harder.
Yes.
Yeah.
Which I thought that was odd, but you just never know. Everyone's different, so we just have to be that comforting person, be that listening ear, be there.
Yeah, and I definitely understand that, because when I went through my divorce and separation from my ex, people would say, "Well, that still bother you? Well, how long are you gonna let that bother you? Are you kidding me, yo?
Right. Yeah, that's not very compassionate.
I just spent 30 years with this person.
Right.
I need 30 years to get over it. Okay? I need 30 years. Okay?
If you need 30 years, come to therapy. We can help you with that.
My therapist
But
at the
you
time.
do need time.
My therapist at the time, she's like, "Look, you spend 30 years with this person.
Yes.
If you need to take 5 years to grieve,
Yes.
then that's what you need to do. As long as you're working
Absolutely.
through your process and you're not just remaining stuck, because you should see some incremental change
That's right.
happening, right? If you are actively working through your healing.
Yes.
So, but as far as people, I realize people are very short with you.
But
When you're going through stuff, initially people are there, right? When it's fresh,
Yes.
people are there. Everybody's there, and they're giving you all the help.
Yes.
And then there was no one. And then the silence.
yeah.
And then it's like, oh my God, you have to face the details of it. And that's traumatizing in and of itself. And I think, again, just walking through that process, but it also helped me to look at myself. The times when I was flippant, the times when I took the person's situation for granted, the times when I thought, just get over it. Because that used to be my favorite phrase until I couldn't get over it.
Okay.
So sometimes I think God allows us to experience those things to show you yourself.
Yeah.
Right? To show you your ignorance, your lack of sympathy and empathy for someone, right? Because definitely, if we're being honest, right?
Yes.
If we're being honest, at times we can find ourselves in that place where we take somebody's situation and we trivialize it, we minimalize it, and we think that they should just get over this.
Yes.
But no, everything hits everybody differently.
Yes.
Yeah, and so that's what made me. Now I'm a little bit more humbled.
Okay.
I got to eat some humble pie, and so now I'm a little bit different in that space. So now, when a person comes to me in that space, now I respond differently.
Okay.
I respond differently because now I understand the traumatic pain.
Yes.
I understand. No, you can't just get over it.
Right.
No, it's a process.
It
that
is
has
a
to
process.
Be, yeah, you can't jump the line. You can't.
And I think you mentioned earlier, people give you really bad advice, like the best way to get over one person is to get under the next. I've never heard worse advice, actually, because it's not accurate,
No, it's not.
right? So
It's more
you just
traumatic.
take all your unhealed wounds into that relationship, and then you just collect unhealed wounds and you just carry them forward into the next relationship. And one thing that I would like us to change the wording around grief and around loss is to never ever say get over it
Oh
or you
God,
will
yes.
get over it. And because some things you don't ever get over, but you get through them. You
Yes.
know, you
Yes.
get through it, you're able to, and by get through I mean you're able to function again,
Yes.
right?
Yes.
Okay, so the death of a young child like your friend is going through, that's life changing. Life doesn't change back in a couple
No.
months or in a couple years. That is life changing. That is a loss that will be with you until you take your last breath, right?
Yeah.
But you can get through it to the point where you're able to function again,
That's good.
but you will always be different. It's like the brain pre-trauma and the brain post-trauma. Your brain is changed and it can get better, but it's always going to have, it'll be different.
That's good.
Yeah, life will be different.
That's good because yeah, it could be years down the road and something will trigger a memory. And you might be in that particular moment, you're reliving that thing right then and there. Now, mind you, it may not be the same trauma, but you might still feel a little pain as
Absolutely.
you are reliving that memory in that moment.
Absolutely.
So yeah, so that's what I like that you'll get through it, but you don't necessarily always get over it.
Right,
You don't
which
ever-
means
yeah,
oh, it's fine.
it's
It's no
fine. I
longer.
don't even think about
it's
it
no longer a
anymore. Yeah,
factor,
yeah,
right?
yeah.
I have a good example of that. When my daughter was a senior in high school, my youngest daughter, we took her to get an MRI, and we had we were used to lots of, she's an athlete, so we were used to a lot of injuries and CT scans and crutches and boots and just the whole nine, right? So, but this was the first time she had an MRI and she had had a CT with contrast before, so no big deal, right? I was like, this will be fine, just another day. We go in there and the lady was like, okay, well, she'll be back in about 20 minutes. Okay, great. No, she'll be back in an hour, is what they said. 20 minutes later, the lady came in and she was like, she's having a reaction to the MRI contrast. I was like, okay. The lady was real calm. She was smooth. She should get an Emmy because she was just like, they're working on her and, we'll be able to take you back in a few minutes. And so I wasn't stressed initially because she was so calm, right? And I was like, okay, so everything must be okay. She had she had a little reaction. No big deal. Come to find out, she went into anaphylactic shock and they
Oh my.
had to do CPR to revive her.
Are you serious?
Yes. And they had
Oh
to do,
my.
they had to do, she was given 3 rounds of epinephrine,
Oh wow.
which, usually
One
one
will
should do the
do.
trick, right? But so she was in significant, dire, she was in very bad shape, right? And so by the time I got back there, I was able to see that she just didn't look like herself. They had all these bags of fluid trying to flush the contrast dye out of her system, and the doctor was like, "We're gonna have her airlifted to Children's Hospital." I was like, "This is really bad. This is really bad." And so, then I saw somebody go get a crash cart and all the things, right? Like I was like, "This can't be happening." I felt like I was watching it definitely out from outside my body, right? I had an outer body experience. I was just watching it. And long story short, and it was a long, dreadful story, but we ended up getting ground transportation in the ambulance and went to the hospital nearby, and she ended up being completely fine, right? But I think it's so significant with trauma because that was a very traumatic experience for me, right?
Yeah.
I was terrified that my child was going to die. And when, like, I was for days just in a haze, right? She was completely fine. She doesn't have any traumatic memory of it. She doesn't remember it at all, thank goodness. But I still had a lot of trauma from it. And so, fast forward 2 years later, right now, I talked with my therapist about it. I talked to friends about it. I thought I processed it. I thought I was good. 2 years later, I took a job at a hospital, and there were where I worked, the helicopter pad was right outside my office.
Oh my God.
And so all of a sudden, every time somebody got airlifted to the hospital, I was having a traumatic reaction.
Oh wow.
And this is so incredible, the way the brain works with trauma. She never even got on the helicopter.
Oh, she didn't.
No, we ended up, a lot of stuff happened, and she ended up being taken by a ground ambulance. But the fact that the helicopter was called and they said the helicopter is here, and then I saw the helicopter when we were walking out to get on the regular ambulance, it stuck with me.
With you.
Yeah.
Wow.
And I didn't think that was going to be an issue until 2 years later, and I see there's helicopters constantly landing outside my office at work. And so I was like, okay, I have some unresolved trauma here. So I had to call up my therapist. I was like, yeah, this is actually really bothering me. So I ended up writing out the story of what happened, the whole story, and really working through it and processing it again, because trauma will definitely come back and get you when you don't even expect it later on. And so that's okay. It doesn't mean you didn't work through it at the time. It means you still have some work to do, and you just have to resolve some more trauma. You just got to keep working through it. So,
and that's helpful. Thank you for that example, because I just think of things that I thought that I worked through, and then I will be revisited with the emotion or the thought, and in myself I would think, oh my God, I'm not healed. I thought I was over this. But I love the example that you give. That yes, you have a measure of healing.
Yes.
But there are still some things that need to be resolved, or some things that need to be healed.
Yes.
So that was good.
Yes.
That was very good.
Trauma
oh my God.
can be triggered. Trauma reactions can be triggered years down the line.
Wow.
Yeah.
Yep. So no, we don't just get over it. Okay?
Right.
It's a process. And that process can take a year. It can take a couple months, but it can take years. And it's okay.
Yes.
It's okay. As long as you're not ignoring it, right? As long as you're not stuffing it down.
Yes.
And you're acknowledging it. Right?
Yes.
And another thing, guys, did you guys hear? The therapists have a therapist.
Oh,
Okay?
definitely.
All right. And I heard another therapist say, if your therapist don't have a therapist of their own, that's not somebody you need to see. So yeah.
I
Is that
agree.
true? Is that true?
I agree.
Okay.
Yes.
Because you guys are humans, and you guys have your own things that you need to resolve yourself. So, and that is a measure of humility, right? That one have to have in order to submit themselves. It's what they do, but they recognize themselves that, hey, I need help too.
Yeah.
And is willing to humble themselves. So if you have a therapist that is not willing to humble themselves and get therapy, you might want to get a new one, right?
I do agree with that. It's like a surgeon who can't do surgery on themselves, right? We go to some really deep places in therapy, and you can't do that all the time on yourself because we have blind spots, right?
That's true.
Everyone has blind spots. So sometimes you need that professional to come
on in.
alongside you and
for
say,
sure.
have you thought about this? Oh, no, I didn't think about that. So, yes.
Okay. So y'all, again, this is so good. We had to cut it up into 3 parts. It's that good. And we wanted you to glean all the information that is being communicated to you. So until next time, let's keep talking about it.